ending up with results and conclusions. Starting with introduction, there are various drugs which inhibits the activity of cytochrome P450 enzyme system, which in turn causes drug-drug interactions and thereby causing poor tolerability of the drug and increased risk of toxicity. One of the major group of drugs which inhibit the cytochrome P450 enzymes is are antidepressants, and the study was done to evaluate the effect of desvenlafaxine and duloxetine on the pharmacokinetics of single dose of desipramine. Now, following on towards the method was divided into 4 periods. Period 1, in period 1 only desipramine was administered and pharmacokinetic analysis was carried on. In period 2, either desvenlafaxine or duloxetine was administered. Following the administration of desipramine, and then pharmacokinetical analysis was carried out by taking out the blood samples. Period 3 was the washout period, and period 4 was the crossover of period 2, which means that alternative doses of desvenlafaxine and duloxetine were given, and afterwards the dose of desipramine was given. Now, following to the results, the final result was that the desvenlafaxine has the minimal effect on the pharmacokinetics of desipramine. This can be seen from the table here. We can see that when desvenlafaxine was given with desipramine, there was a minimal increase in Cmax, whereas when duloxetine was given, there was a large increase in Cmax. The same can be seen with area under curve and t-half, that when desvenlafaxine was given, there was a very little increase, but when duloxetine was given, there was a very large increase. And in case of clearance, when desvenlafaxine was given, there was a decrease in the clearance, and but when duloxetine was given, there was more decrease as compared to desvenlafaxine. This showed that the drug stayed in the body for a more period of time when duloxetine and desvenlafaxine were given. This can be shown from the graph also. When desipramine alone was given and when desipramine and desvenlafaxine was given, there was an increase when desvenlafaxine was given. But the point here to be noted is the t-half for the drugs was all same. Now the safety analysis, that was the experiment safe? So it was not that safe because 70% of the patients encountered adverse effects. When duloxetine was given, most common side effect was diarrhea. But when desvenlafaxine was given, one of the patients suffered from seizure, and some common effects were seen as tachycardia and hypertension. To conclude with, we can tell that the drug interaction causes the poor tolerability of the drug, and there is an increased risk of toxicity. But here in this study, we can see that as desvenlafaxine is not affecting the desipramine in a large manner, so there is a decreased risk of interactions, and so it is safe to give desvenlafaxine and desipramine in combination. This was all from me. If you have any questions, I'll be happy to answer.